Hi, I'm Laura Glennie and I'm a member of the student support team at West Lothian College. My job is to help coordinate student mental health and wellbeing information. And today I've put together this session on why seeking help for your mental health and wellbeing is a good idea. Lots of us know about the different types of support that are out there, but not necessarily how it could help you or why talking actually helps in the first place. So here's some information on that. First, I thought it'd be good to clarify that no, it's okay to ask for help. We accept that mental health issues are common at West Lothian College. It's not just a buzzword or rumour or a catchphrase. And just like your physical health, mental health is part of every single one of your lives. It says on the screen that 1 in 6 people in the past week have experienced a common mental health problem. These are stats from 2016, and we know that at least in 2021 and beyond, almost everyone experiences a mental health challenge. So the college are aware of that, and it's not something to be ashamed of or to hide if that's a way that you feel sometimes. Making it clear that asking for help is proven to be helpful. And so in other areas of our life, like you're probably not a car mechanic. And if your car breaks down, a lot of us wouldn't think twice about asking someone else to help fix it because we know that they're experts and that a second opinion makes sense. But there's some areas in our life where it's still seen as a taboo or embarrassing to speak to an expert. And we want to fix that because we know that seeking for support for our mental health and talking to someone does actually help. So, to help get our head around why that is, I thought I'd speak about a concept called the vicious cycle. The vicious cycle can be particularly helpful if you're someone that copes with difficult feelings, difficult thoughts, or obsessive or repetitive thoughts and feelings and worries, or someone with anxiety even. So thinking about the vicious cycle, we know that outside events don't come with a set thought, feeling, or reaction. And we personally react differently to different things. Everyone does. So an outside event might happen and we have thoughts, and the way that we think will lead to the way that we feel. And the emotions that we have will lead to physical feelings, and those physical feelings will inform the way that we behave. So an example might be the outside event could be looking for jobs online and your computer crashes and won't work. Well, a lot of people, if they're having a bad day, might think, this is hopeless, nothing goes right, what's the point in even trying? Now, those thoughts will make someone feel a certain way. You might feel angry, sad, deflated, or anxious if you think those things. Feeling angry, sad, deflated, and anxious might give you a heavy feeling in your chest. That's a physical feeling. And having a heavy feeling in your chest might be quite overwhelming, and you might go to bed and cry. But when it becomes a vicious cycle is doing things like throwing your laptop or going to bed and cry won't help if that happens every time something difficult comes up when we're applying for jobs. So sometimes the way to manage difficult stuff is to work through what exactly is going on in my cycle and what thoughts or feelings could I really work on. And sometimes just changing one small thing in this cycle can lead to a sort of healthier knock-on effect. And talking to someone is the way that we can really unpack what's going on there and what it is that we'd like to change. So really, we're not asking you to judge the way that you think or react. We're asking you to really have a look at it, examine and express the emotions that you're feeling. It's not about finding a solution always, it's about making things more manageable or getting to understand them as well. So when we talk to a professional for support or use a service, they are going to help us work out our emotions. Experiencing emotions of fear, anxiety, and aggression fires up something in our brain called an amygdala, which you can see on the label on the screen. It's the little red bit. And what the amygdala happens when it fires up is our brains are trying to work out what to do. Should we run away? Should we freeze on the spot? Should we fight? How should I respond to this, basically? Which is helpful if you do need to run away or freeze on the spot or possibly even fight. But when our amygdala is fired up, it's not always in the most helpful situations like exams or social situations. But when you talk through your feelings, the feelings of anger or fear, we can identify that we're not in danger that there's not a threat, or maybe that we're not thinking logically in the moment. Being able to do that can help you cope with the feelings next time and understand really exactly what's going on and what is overwhelming you. And that's because of this part in the brain that we work on. Putting feelings into words can reduce the response of this part called the amygdala, and that helps us react better. Some people call that affect labeling. And you've also got to recognize that holding back thoughts and emotions is stressful, and your brain does have to do work to repress these thoughts too. So that's another reason why seeking support can help. So apart from working with our thoughts, there's so many benefits to working with others on your well-being. There's an improved quality of life, which can help you live life to the fullest. Improved relationships. So when the symptoms of your mental health challenge aren't sapping your strength, you're better able to develop and maintain healthy relationships, and you'll have more time for people in your life as well. Also thinking about reduced risk for medical issues. So some untreated mental illnesses can contribute to physical problems like ulcers or colitis, and it can reduce the strength in your immune system. So if you can get treatment for your well-being and your mental health, that could decrease your potential need for certain medical services or certain physical symptoms. Encouragement and support. So individual therapy can help you understand yourself and your goals better, and group therapy can expose you to others with similar experiences. Reduced chance for complications. So some people that have mental health issues might also have something like substance abuse or alcoholism in their history. Getting mental health treatment can kind of diminish the possibility of that getting triggered or help you stay on top of things as well. So when we do go to talk to someone, there is a few tips I have for you. These could be when you reach out to family and friends, but it's a great tip for anyone really. And the first picture on the screen, the little sort of area marker, is to remind you to choose a time and place where you and the person you speak with both feel comfortable. Think about whether you'd prefer to talk to someone indoors, outdoors, doing an activity, or sitting down for a chat. The second image, the wee nervous man, is to remind you that it's normal to feel nervous at any time you share a big piece of news. Nerves leading up to the chat can sometimes be harder than having the actual chat. So if you think that that's you, remember that the feeling of fear is possible to experience that and to get what you need done. So is it possible to feel the fear and do it anyway? And what can you do to mitigate those feelings of fear and make yourself feel a bit better before and after? And the journal over there is to remind you that you can try practicing writing what you want to say. So you can write it on the notes on your phone, or write it as a letter or an email. And it's just to avoid your head going blank when you go to have a conversation. And the last image is to remind you to try to have an idea about what you want to get out of a conversation before you go ahead. So do you simply want to tell them what's going on with you? Do you want them to help you talk to someone else, like a professional? Do you want them to interrupt without listening or give feedback? Try and think about that and think about how you can clearly communicate that to the person helping you. The overall message with all of this is it's important to remember that you're not alone and that you do deserve support. It's maybe good to recognise that not everyone is going to understand or know how to offer support for mental illness or mental health challenges immediately. And if someone reacts negatively to news of your illness, you might choose to give them space or offer them some more information. Some people do react dramatically to news like this. It's hard to take this kind of information in at first for some people. Although mental health problems are common, it might be the first time they've ever spoke to someone about having one. But please, please don't give up looking for support. Sometimes it can take a few attempts to find the right person and the right fit for you, whether that's friendships, doctors, medications, or anything else in life. But once you're armed, knowing that you can expect these kind of challenges, hopefully it'll feel like less of a knockback. Everyone deserves to find the best support for them, but just accept that that can take time and do not give up. If you enjoyed this presentation, or if you have some feedback, or there's some support that you think that could be offered at West Lothian College that's not already on offer, please give me an email. It's on the screen here. So my email is lglennie@west-lothian.ac.uk. I'd be happy to talk through any of this, and I really hope that that's given you an idea about what support could offer you. Thanks for listening. Bye.